Did you realize that by the time you reach the end of this video, nearly 20 older adults will have been diagnosed with dementia? That equals one new case every 66 seconds. And here's the chilling question. What if the real culprit isn't simply aging, but the collection of pills in your medicine cabinet? For years, you've been told these medications are harmless, routine, even essential. Yet new scientific findings are raising serious alarms. The truth is, 99% of seniors are unaware that at least one drug they're taking could reduce the size of crucial memory centers in the brain by more than 28% in under a single year. Think about that for a moment. And what about the pharmaceutical companies? They've had knowledge of these dangers for decades, yet continue to earn billions selling the same products that may be speeding up memory loss and mental decline in millions of seniors around the world. Consider this. A 2023 study published in Neurology and Aging Research found that just one class of medication raised the risk of dementia by 49% among seniors within only 2 years of use. That's why in this video, we're going to uncover the 9 most dangerous medications driving rapid memory loss and dementia, counted down from the ones most overlooked to the most destructive. And pay close attention to number 3. It's a drug prescribed to millions for something that seems harmless, yet it can shrink key memory centers in the brain. Chances are, you don't even know it's happening. But before we begin, I want to hear from you. Drop a comment below. What medications do you take on a daily basis? Have you ever experienced sudden brain fog or forgetfulness? We're reading every single response and offering personalized insights. Don't stay silent. Your story could help save a life, maybe even your own. So let's get started. Coming in at number 9 is a drug you've almost certainly seen or even used. It sits in nearly every senior's cabinet, quietly wreaking havoc on the brain before the damage is even noticeable. Number 9. Diphenhydramine, Benadryl. Diphenhydramine is that well-known pink pill millions turn to when they want help falling asleep, calming allergies, or soothing cold symptoms. It's inexpensive, available over the counter, and very likely sitting in your nightstand right now. But here's the dark side. While you might think it's just helping you sleep or breathe easier, inside your brain it's disrupting the hippocampus, the critical region responsible for forming and storing new memories. Diphenhydramine belongs to a group of drugs known as anticholinergics, which interfere with acetylcholine, the neurotransmitter that helps the brain stay alert and learn new information. As the brain ages, it becomes even more dependent on every bit of acetylcholine it can get. Blocking that process can have devastating effects. In fact, a 2023 study published in the Journal of Geriatric Cognitive Health found that seniors who regularly used anticholinergic drugs had a 54% higher likelihood of developing dementia compared to those who didn't use them. So how do you protect your memory? First, steer clear of any medication containing diphenhydramine, especially if the label includes terms like PM, nighttime, or allergy relief. These are often just Benadryl in disguise. And if you're relying on diphenhydramine for allergies, there are newer and safer alternatives. For example, loratadine, commonly sold as Claritin, doesn't cross the blood-brain barrier and is much safer for long-term use in seniors. But always remember, never stop any medication abruptly, and never assume that over-the-counter automatically means safe. If a common OTC pill can do that, what about medications we take for chronic issues? The next category shows how a long-term digestive fix can quietly chip away at your cognition. Number 8. Proton pump inhibitors, PPIs. Prilosec and Nexium are 2 well-known drugs in a class called proton pump inhibitors, or PPIs. These medications are designed to reduce stomach acid and are widely prescribed for issues like heartburn, GERD, and acid reflux. Many seniors remain on these drugs for years, even decades, because as soon as they stop, their symptoms tend to return. But what's rarely explained is how PPIs interfere with the body's ability to absorb vitamin B12. This nutrient is absolutely essential for protecting the brain, supporting memory, sustaining focus, and maintaining stable moods. A large 2016 study published in JAMA Neurology looked at over 73,000 people aged 75 and older. The results were clear. Seniors who regularly used PPIs had a 44% greater risk of developing dementia than those who didn't. Here's why. By aggressively reducing stomach acid, PPIs prevent the body from properly absorbing not just vitamin B12, but also magnesium and calcium, minerals essential for healthy brain function and neural communication. Without these, neurons misfire and struggle to send signals, leading to confusion, memory lapses, and symptoms that often mimic early Alzheimer's disease. It gets worse. PPIs have also been shown to increase levels of amyloid beta plaques in the brain, those toxic proteins strongly associated with Alzheimer's disease. But here's the good news. Safer alternatives exist. If you're taking a PPI every day, ask your doctor if you can slowly taper off with the help of H2 blockers such as famotidine, sold under the brand name Pepcid. While not perfect, these drugs are much less likely to interfere with cognition. Natural remedies can also help. For instance, chewing deglycerinated licorice, a natural compound that coats and soothes the stomach lining, may provide relief without harming the brain. And if stomach pills can set you up for memory trouble, consider what happens when a medication directly crosses into the brain. The next one does exactly that, and it's surprisingly common. Number 7. Bladder control medications. Oxybutynin, sold under the brand name Ditropan, is a common prescription for seniors dealing with urinary incontinence or an overactive bladder. On the surface, it seems like a simple, practical solution. Nobody wants the embarrassment or frustration of constant bathroom trips. But beneath that convenience lies a hidden threat. Oxybutynin works by blocking acetylcholine, the same neurotransmitter disrupted by Benadryl. Unlike weaker drugs in its class, oxybutynin easily crosses the blood-brain barrier and directly impacts the hippocampus, the memory center of the brain. This makes it especially dangerous for seniors, particularly when used over long periods of time. A 2019 study published in the BMJ revealed that people over 65 who took powerful drugs like oxybutynin for more than a year faced a 49% greater risk of developing dementia. What makes this so concerning is that the harm is often mistaken for normal aging. Patients frequently describe feeling foggy, forgetting appointments, misplacing belongings, or struggling to follow conversations, all signs that may be linked to the drug rather than natural decline. The silver lining is that safer options are available. Newer medications like mirabegron, sold as Myrbetriq, operate through a completely different mechanism and have been shown to cause far fewer memory-related problems. We've looked at over-the-counter pills and bladder meds, but what about drugs prescribed to protect your heart? The next entry shows why even a lifesaver can carry hidden neurological costs. Number 6. Statins. Statins are among the most widely prescribed drugs in the world, especially for people over 60. They are meant to lower cholesterol and reduce the risk of heart attacks and strokes. Simvastatin and atorvastatin, which are sold under the brand names Zocor and Lipitor, are the two most common ones. But here's where the problem starts. Cholesterol isn't just a heart issue, it's a brain necessity. The brain is made up of nearly 60% fat, and cholesterol plays a key role in creating and maintaining the myelin sheath, which is a protective coating that helps nerve signals travel smoothly. When you aggressively lower cholesterol, you may also be starving the brain of what it needs to function. In a 2023 study published in Frontiers in Aging Neuroscience, seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of mild cognitive impairment, and those on high doses had even more noticeable declines. What's even more concerning is that some patients reported sudden onset memory loss, describing moments where they couldn't recall names, recent conversations, or even familiar driving routes. Now it's important to understand that not all statins affect the brain equally. Some like pravastatin and rosuvastatin do not cross the blood-brain barrier as easily and are considered less risky in terms of cognitive side effects. If you've been on a statin for years and you're noticing fog, forgetfulness, or confusion, it might be time to talk with your doctor about a dose reduction or alternative strategy. Don't wait until it becomes irreversible. The earlier you take action, the better your chance of protecting your mind for the years to come. If heart medicines can dull memory, what about drugs taken for sleep and anxiety? The next class can feel like a relief at first, until the trade-off becomes painfully clear. Number 5. Benzodiazepines. Benzodiazepines, which include drugs like lorazepam or Ativan, diazepam or Valium, and alprazolam or Xanax are some of the most widely prescribed medications for anxiety and sleep problems. They work by enhancing GABA, which is the brain's calming chemical that reduces overstimulation. At first, they seem like lifesavers. They quiet the mind, ease panic, and help with sleep. But over time, these drugs become something else entirely: a trap. A 2022 study published in the BMJ followed over 8,000 seniors over a 6-year period and found that those who had used benzodiazepines for more than 3 months had a 51% increased risk of developing Alzheimer's disease. The risk went even higher for long-acting benzodiazepines like diazepam, which stay in the body longer and accumulate in fatty tissues including the brain. What happens is a kind of chemical sedation that slows neural activity. That means your brain stops learning as quickly. It becomes less flexible, less efficient, and more prone to confusion, memory gaps, and emotional dullness. Seniors on benzodiazepines often describe feeling like they're in a fog, disconnected, or just not themselves. And the worst part is when they try to stop. Withdrawal symptoms like anxiety, agitation, and insomnia can be severe, making the drug feel essential when it's actually the source of the problem. To correct this, here's what you need to do. If you've been on a benzodiazepine for more than a few weeks, do not stop suddenly. This can be dangerous. Instead, work closely with a doctor to taper the dose gradually. Alternatives like buspirone, which is a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety, can help restore calm without causing memory loss. And if anxiety pills can cloud your thinking, consider what happens when a pain or sleep aid also blocks memory chemistry at its core. The next drug is a prime example. Number 4. Amitriptyline, Elavil. Amitriptyline, which is sold under the brand name Elavil, is an older antidepressant that is still commonly prescribed today for pain, insomnia, and sometimes even migraines. At first glance, it may seem like a multi-use miracle pill, but under the surface, it's one of the most potent anticholinergic medications still in circulation, which means it blocks the action of acetylcholine, the chemical that helps neurons communicate, form memories, and stay sharp. In fact, it blocks it so strongly that the effects on cognition are not just possible, they are expected with long-term use. In a massive 2015 study published in JAMA Internal Medicine, researchers examined over 3,400 adults aged 65 and older, and found that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. That's not just a slight increase. That's more than half again the normal risk. What's terrifying is that many of these patients were not told that the drug could harm their memory. They were often prescribed amitriptyline for sleep issues or nerve pain, and then slowly began noticing changes like short-term memory loss, word-finding difficulties, and foggy concentration. It doesn't take a high dose to cause problems. Even low-dose amitriptyline taken nightly over several years can create a slow, invisible erosion of brain power. The damage happens silently. No warnings, no symptoms at first, just a gradual decline that looks like aging but is actually drug-induced cognitive impairment. So if you or a loved one is on amitriptyline, speak with a physician about alternatives. For nerve pain, options like duloxetine or gabapentin may offer relief without the same level of anticholinergic burden. For sleep, melatonin or low-dose doxepin, which has a much milder anticholinergic profile, can be used instead. And for mood support, there are newer antidepressants like sertraline or escitalopram that are generally considered safer for the brain. Now, if a single antidepressant can undermine memory so dramatically, what about another modern option that quietly carries the same hidden mechanism? That brings us to number 3. Number 3. Paroxetine, Paxil. Paroxetine, which is sold under the brand name Paxil, is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for depression and anxiety. At first glance, it appears to be a modern antidepressant, one that's supposed to be gentler than the older generation of drugs. But here's the part they don't tell you. Paroxetine is the only SSRI that has significant anticholinergic properties, which means it interferes with acetylcholine in the brain. That one detail makes it drastically different from its SSRI siblings like sertraline or escitalopram. In a large 2021 review published in Frontiers in Psychiatry, researchers examined the cognitive profiles of elderly patients taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within the first 12 months. The study also found that seniors on paroxetine were 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The irony is that it's often prescribed to stabilize mood, yet it ends up undermining mental clarity and emotional regulation over time. The fix here is straightforward, but essential. Avoid paroxetine entirely in seniors. The American Geriatric Society has placed paroxetine on its Beers criteria list, which is a list of medications that are potentially inappropriate for older adults. If you're on it, ask your physician about switching to safer alternatives like sertraline or escitalopram, which are better tolerated and don't carry the same cognitive risks. In addition, supplementing with B vitamins, especially B12 and B6, can help support mood naturally. If mood medicines can accelerate decline, what happens when drugs meant for severe psychiatric illness are used just to manage behavior or sleep? The next category shows why convenience can come at a catastrophic cost. Number 2. Antipsychotics. This one is especially alarming because many seniors don't even know they're taking an antipsychotic. Drugs like quetiapine or Seroquel, risperidone or Risperdal, and olanzapine or Zyprexa were originally developed to treat schizophrenia and bipolar disorder. But today they're frequently prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes associated with dementia itself. That's right. These are drugs that are supposed to be for severe psychiatric illness, but they're being used in nursing homes and hospitals for seniors who are simply confused, restless, or hard to manage. The consequences are devastating. In 2022, a comprehensive study in the Lancet Healthy Longevity followed more than 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to develop worsening cognitive decline within 12 months, even if they had no prior history of dementia. Worse, these drugs increase the risk of stroke, sudden death, and severe sedation, which can lead to falls, hospitalization, or permanent institutionalization. The mechanism is brutal. These medications suppress dopamine, which is a chemical that's not only linked to mood and motivation, but is also critical for executive function and memory processing. When dopamine levels crash, the brain becomes sluggish and unresponsive. This is why seniors on antipsychotics often appear dull, emotionally flat, or zombified. Their personalities fade, and family members begin to mourn someone who's still physically present. Correcting this situation starts with asking hard questions. If you or a loved one is on one of these medications, ask the doctor why it was prescribed and whether it's truly necessary. In many cases, behavioral symptoms can be managed with non-drug interventions, creating structured routines, reducing noise and overstimulation, addressing pain or discomfort, and improving lighting and sleep hygiene. When medications are absolutely necessary, lower doses for shorter periods can reduce harm. But more often than not, these drugs are used out of convenience, not necessity. The tragedy is that many families are not even told what these drugs do. They just see their loved one declining without knowing the cause is chemical, not natural. And if a single powerful drug can distort cognition, imagine what happens when several of them pile up together, all hitting the same memory pathway. That brings us to number 1. Number 1. Anticholinergic polypharmacy. This is the hidden danger that almost no one talks about, and it's one of the biggest contributors to drug-induced dementia in the elderly. You may be expecting a single drug to top this list, but the most dangerous medication for rapid dementia in seniors is not one pill. It's the silent, creeping effect of taking multiple medications with anticholinergic properties at the same time, a situation known as anticholinergic polypharmacy. Imagine this scenario. A senior takes diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each one alone may cause only mild memory problems, but together they compound, and the cumulative anticholinergic burden skyrockets. This isn't just a theoretical concern. In a 2022 analysis published in Age and Aging, researchers tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia within 10 years. That's more than double the risk. And here's the worst part. Most of these seniors had no idea they were even on anticholinergic medications. When you block acetylcholine from multiple angles at once, your brain doesn't just slow down, it begins to decay. Neurons wither from underuse, synapses shrink, and the brain enters a hypoactive state that mirrors Alzheimer's disease. Correcting this doesn't require a miracle. It requires a medication review. Ask your doctor or pharmacist to evaluate your full list of prescriptions, over-the-counter drugs, and even supplements for their anticholinergic load. There are online tools and professional software that can calculate the cumulative burden. Once identified, you can work to deprescribe, slowly tapering off unnecessary medications, switching to safer alternatives, and rebalancing the brain chemistry. This is the most empowering part of this entire video. Drug-induced dementia is often reversible. When the burden is lifted, many seniors regain clarity, energy, and memory function within weeks or months. The brain is resilient, but only if you give it a chance. Polypharmacy is not just dangerous, it's preventable. And that makes it the #1 hidden medical threat to the minds of our aging population. Now it's your turn. What medications are you currently taking? Have you noticed any brain fog, forgetfulness, or personality changes since starting a new medication? Are you willing to talk to your doctor this week about reviewing your medications? Share your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.